Should we start?
Hello and welcome. I welcome you all to this international a heartiest welcome to one and all. I, Dr. Asavri Savan, on behalf of Team Voice of Healthcare, welcome you all to the International Men's Health Week discussion organized by Voice of Healthcare and powered by AstraZeneca. So today's discussion is on the topic of men's health. The topic is early diagnosis and treatment options for prostate cancer in India. To discuss and deliberate more on this topic, we have both the clinicians, people from the public health sector, as well as patient voices today here with us. Let me welcome Dr. Anil Mandhani, who is the Executive Director of Urology at Fortis Memorial Research Institute, Gurugram. Welcome, sir.
Hello, everyone.
Next, I welcome Dr. Santosh Waigankar, who is the consultant of Urologic Oncology and Robotic Surgery at Kokilaben Dhirubhai Ambani Hospital and Research Center, Mumbai. Welcome, sir.
Thank you.
I also welcome Dr. K. Madan Gopal, who is the senior consultant at Niti Aayog. Welcome, sir. We also have Dr. Vineet Talwar, Director, Department of Medical Oncology at Rajiv Gandhi Cancer Institute and Research Center, New Delhi. He will be with us shortly for giving voice to patient Singh, who is doctor in his field. He will be talking about his journey with prostate cancer with us today. He is accompanied by his son, Mr. Singh, who would be voicing the voice of caregivers. We also have another patient voice by Mr. Ram Bhola Shah, who would also be giving voice to his journey with prostate cancer. With that, let me hand it over to Dr. Santosh, who would be leading the session for us today. Over to you, sir.
Dr. Savan, thank you so much for introducing all the allied panel who are there, who have come together to discuss a very important topic, which I believe needs prime attention because the data that's coming up seeks us to discuss it in detail. The panel does it in introduction. Dr. Asavri has already done that. So let's get to the relevant points. I welcome all the viewers and thank you for joining us and listening to us on this topic. So the talk would be divided into two parts. First would be a discussion on early diagnosis and how to come to a diagnosis, what sort of symptoms the patient presents within prostate cancer. And second part of the talk would be focused on once the cancer is discussed, how we treat it. It will also be punctuated by experiences by Dr. Pritam Singh.
मैं आपको ना स्पीकर पे डाल रही हूँ.
Mr. Bola.
आपका कॉल पे रहो बस. ठीक
Dr.
है?
Savan, your mic is on. You can mute yourself, please. So, getting on to the discussion, I would like to welcome Dr. Mandhani, and I want to ask sir, we talk about prostate cancer, and it's very important that we focus on early diagnosis of cancer so that we'll be able to pick up this disease early and we'll be able to get the relevant treatment to the patient so that we can improve or better their quality of life. So the questions which are normally asked is, what are the early signs which the men have to be aware of when we are talking about prostate cancer, which should help them to differentiate and make them probably think that we probably have a doubt of having a prostate cancer. Dr. Mandhani.
Yeah, hi Santosh, thank you. And it's good that we have Dr. Madan with us. So,
Yes.
see, for diagnosing any cancer in the body, it's always good to diagnose it as an early stage so that we can cure it. Unfortunately, prostate is such a organ. Like even if you diagnose it, the treatment is not free from complications. It's not like treatment of any other cancers because it comes with two important complications like impotency and incontinence. So it is very interesting. I mean, in the US, if you ask me, this is the most common cancer in men. But is it so in India? Unfortunately, as with most of the cancers, we do not have epidemiological data because we do not have epidemiological studies. So what we have seen that it has now become one of the top 10 cancers, rather one of the top 5 cancers in men in India, probably because of a resurgence of treatment with presence of robotic approach. Now more and more urologists are taking interest. So that could be the part. Now, coming to the early signs, unfortunately, prostate cancer does not produce any signs. It does not give you a warning signal that, oh, let's pick me up early so that you can cure me. So the only way we can pick it up early is PSA. That is very interesting, and I'll take a few minutes to give you my wisdom and knowledge based on data which I have published recently in Indian Journal of Urology. It's quite an interesting article and it's worth reading. So, in the US, the recommendation used to be like every man with after the age of 50 till 70, he should have PSA. So, once you turn 50, PSA should be done, and even in primary healthcare centers. But it is not a recommendation in India. So, should we copy that? So, if you look at the recent development, like there is one organization, it's called US Preventive Service Task Force, which gives recommendation whether you should screen for any cancer or not. So 2 years ago, they gave recommendation as D. That means you should not screen prostate cancer. That means once you turn 50, there is no need for getting your PSA done. But there was a lot of hue and cry against it. So now they have changed it to recommendation C. That means you discuss with the patient about the pros and cons of PSA screening, which is theoretically very complicated, and it would not be possible in India because still in India, a lot of men at that age they rely on us and they believe that whatever we say, they will believe it. So just to conclude on the screening part, I would not say that we should start screening in normal, healthy men after the age of 45 or 50. Rather, what data I have presented in the Indian Journal of Urology. So, what we are doing are two kinds of screening to pick the cancer early. One is opportunistic screening, like whosoever is coming to urologist OPD, or nowadays physicians are also getting seeing such patients. So we recommend PSA as part of the general routine test we prescribe. So that is called opportunistic screening. And the second screening, which is very common in metropolis and larger cities, is a health checkup. So a lot of men are having their routine health checkup, even if they are healthy. So in that, PSA is a part of their routine health. Unfortunately, maybe Niti Aayog should come up with the guidelines. I have seen a lot of corporates in Delhi. They are doing PSA at the age of 30 also, which is stupid thing. So that should be streamlined. So what data I have presented that let's not have routine screening or preventive screening of anyone who is turning 50. Rather, whosoever is coming to health checkup or who is coming to OPD, they should have PSA. So what I found the difference, like I have two data set, one data set of 25,000 men who presented to urologist with symptoms. So of those 25, when we analyze the PSA positivity, that means the significant level of PSA, which is considered as more than 4, was around 28%. But in men who are coming for executive health check, PSA positivity rate was around 3%. But the one important difference which I could share with you, which we could derive from that data set, is that men coming up for executive health checkup, none of them was detected to have advanced prostate cancer. But in opportunistic screening, like when we are seeing patient with symptoms and doing screening, then about 62% had advanced or metastatic prostate cancer. So this is a very significant difference which we need to bring it down. So these two things, I think, whosoever is coming for health checkup or whosoever is coming to physician's clinic, PSA should be part of the screening. So in that way, we can pick up cancer. And another good thing which has come up is MRI, which is a part of reducing over diagnosis and over treatment. The problem of PSA is that raised PSA does not always mean cancer. So you need to confirm it by another test. And fortunately, now we have MRI, which gives some kind of suggestion that no, now this gentleman has more chance of having cancer. So better to do biopsy, because biopsy is painful, and we cannot diagnose cancer without biopsy. So with this kind of approach, I think with aging population in India, we should be proactive in picking cancer early. And now we have very good treatment in form of robotic surgery, which would really benefit our patients.
Thank you.
Santosh.
Yeah, thank you so much, Dr. Mandhani. I think these are very relevant points you have picked up with respect to our part of the subcontinent. And it's what important message I want to reiterate here is that early diagnosis is very simple. You need to get yourself evaluated by doing a simple blood test where you look at an antigen called a prostate-specific antigen or PSA. And Dr. Mandhani has also discussed about when it has to be done. Anybody at the age of 50 and above should get it done. Most of the questions most of them they ask that how do we remember? Well, what I usually tell my patients is that you know your birth date. So once you know your birth date, the week following your birth date, you can plan your executive health checkup, and obviously the PSA should be a part of it. But what is important is awareness, and it's important that you share this information with your peers as well, the viewers who are listening. Dr. Mandhani, one thing I wanted to ask is the fear in the mind of viewers is that when you talk about cancers, you need to undergo some very elaborate test and big tests. So you said that just a simple blood test which can be done to detect early prostate cancer. But what to do? Are there any issues regarding PSA, or is every time when the PSA is high, does that mean the patient has cancer? Can you just put a light on it,
Yeah,
sir?
yeah, it's a very good question. So for general public, raised PSA does not mean cancer. It is just an indicator that you may have cancer. So I think a person should realize an infection in the prostate gland cause raised PSA, or if they have some procedures like catheterization for retention of urine, that can increase PSA. If they have no evidence of infection and they are otherwise having mild symptoms, so raised PSA should raise an alarm, but it doesn't mean that they have cancer. The second test they should ask for is MRI, which is ubiquitously available. It suggests that the patient may have cancer. It adds to our confidence. There are other lab tests like free PSA or PHI, which a doctor can prescribe to you. So at least with raised PSA, we have two or three more diagnostic tools to reach to conclusion whether you need biopsy or not. And after the biopsy, another myth which I have seen, a lot of men, they think that biopsy can cause spread of cancer further if they have the cancer, which is a myth. It is not so, because nowhere in the world cancer is diagnosed without the biopsy. So biopsy is a simple procedure. It does not increase the risk of cancer, and without the biopsy, nobody till date nobody can diagnose cancer. So yeah, with the two or three additional tools, we gain confidence, and with the biopsy, you have the diagnosis of cancer.
Thank you, Dr. Mandhani. And one more thing is that biopsy is an outpatient procedure where you can visit the person who's doing the biopsy,
Yes.
and you can take rest and you can immediately go home. So it is not something which you need to be admitted for, but it is
Yeah, it's a
essential, as
take.
Dr. Mandhani said, that you cannot label a person as to having prostate cancer without doing a biopsy. So, Dr. Mandhani, as we spoke about confirmation of cancer, once the PSA is high, how do you decide treatment? Now, that treatment part is going to be in part two, but I just want you to emphasize on how do you stage and grade a prostate cancer so as to come to a decision as to what sort of treatment can be given to these patients.
Yeah, Santosh, fortunately, we have a better imaging available. So once we diagnosed on biopsy that patient has prostate cancer, so looking at initial PSA and grade, what result we get on biopsy is uh, grade of the cancer. It's Gleason grade. So if the grade is high and PSA is maybe more than 10 or 20, then we usually advise. I mean, the chance of cancer being present in other part of the body is very high. So we advise for PSMA PET CT. If PSMA PET CT is not available, then maybe the bone scan is good enough to stage the disease, because you already got MRI done, so you have some idea about the soft tissue in the pelvis, and with the bone scan combined, you have a good idea of spread. Otherwise, PSMA PET CT is a better choice of investigation. So once you have the stage, so for early stage, I think we give option to the patient for radiation and hormone therapy or radical surgery. So they have to choose. Many a times, patients they ask us which one is the best. So you see, to be very honest with you, it's physician's bias. Like if patient is coming to a surgeon, he would insist that surgery is good, but if patient is going to radiation oncologist, he would say the radiation is good. So both are same, but there are pros and cons with each procedures, which can be discussed, and rather patient should ask the doctor, like, why not radiation or why not surgery, what are the advantages and disadvantages. So it is a cumulative decision making, because just diagnosing cancer is not the end of the story. The journey starts from there. So it should be a teamwork between patient and doctor, and whatever treatment option he chooses, the journey is long. It's almost for 15 to 20 years, where doctor really has to take care of the patient's disease.
Thank you, Dr. Mandani. Before I move on to Dr. Madan, just one comment I want from you, sir, is that if being a senior treating uro-oncologist, what's your take on availability of machines like MRI or like multi-parametric MRIs or PSMA PET scans in the remotest part of India? Since we're talking about healthcare for all and accessibility of this healthcare, since we are talking about early diagnosis and availability of them to the masses and classes. So what's your take and what's your thought about availability of this technology to all the people in the country?
Yeah, so Santosh, as I said, if patient out for surgery or if patient presents with early stage, suppose he is in the remotest part of some Indian village, so the doctor there, at least he should understand the value of PSA. He should do rectal examination, and if MRI is not available, CT is good enough, and a biopsy can be done with finger guidance, even in a village. So those biopsy slides can be sent to district level, and if they I mean, there are now very good facility of video calling. So with video call, I think we should not deprive those patients of the best treatment available. And I think with PMSSY scheme, even in category B cities, a lot of hospitals have robotic facility, so they can be referred to those centers, and they can be given the best treatment options with video connection and this kind of audio visual facility. Yes, why not?
True. So very true, sir. So, Dr. Madan, thank you for joining us, sir. And my question to you is that, see, we have the intent and we want to make things available, but it won't be possible without the government support and the policies when they are put in place. So, as we say that this awareness, most important thing about treating or getting to the root cause of the disease or treating the disease or making things available is creating basic awareness among the people. So, what's your take on this? So, what's the government's take on creating awareness? For example, for prostate cancer, for example, as simple as doing screening, which helps to pick up early cancer. So, what's your take on it, sir?
Thank you, Santosh. As you have rightly mentioned, awareness is the key. If you look at the people, how many people above 40, 50 years of age, they are aware about the cancers, the proneness to cancers. Not to talk about whether they go for the executive checkups and other things. These executive checkups and other things, they are more or less restricted to tier 1 cities and some of the tier 2 cities. Here also, you are just focusing on a blood test as well as the few scans. And in the USG also now they are writing the size of the prostate and other things, and they write that correlate clinically. That's one way of screening which is happening currently. But nevertheless, cancer has been always been a part of the agenda, and we do have a cancer program which is exclusively targeting the other sites, not prostate per se, because we require some evidence whether it is really a public health problem or not to be a part of that. But nevertheless, screening do happen. We do have mechanism for screening of cancers. Cancer. Because why I'm saying this, because the NCP CDC program, that is National Control Program for Cancer Communicable, Non-Communicable, that's a part of that. If you look at the way things have progressed in the country, previously we were focusing on providing 6 services through the system, that is the sub-health centers, which is now upgraded as health and wellness centers. These services are now been upgraded to include 12 services, including NCD screenings, and cancer being part of that. Now, slowly and slowly, we are seeing that how cancer can be screened at that level. And each health and wellness centers in the remotest part, they usually do a symptomatic screening. And that's the only thing they can do, because at that level, you are having a community health officer who is a mid-level service provider, who could be a nurse, who could be a trained officer, not the medical officer. The medical officer is at the primary health centers, and that's a challenge. That means whether the availability of medical officers there. The clear-cut medical officers, for most of the community health center, they do have medical officers, but as Dr. Mandhani has pointed out, that the doctors needs to be aware that they need to they need to look for the symptoms, and they could advise the patient appropriately. That means capacities are also challenged, and some work needs to be done at that level also. The second aspect is, after the things are diagnosed, we do have a program in the form of Pradhan Mantri Jan Arogya Yojana, where prostatic surgeries are already listed out there. And apart from the list of the packages, if the person is having cancer and that kind of related ailments, that is also covered. The unclassified packages are there. If a package is not there, listed out in the 1400 plus packages, the hospital can request, saying that these are the combination, they can get a pre-authorization and they can get the person treated. That means for the screening of the patient, so that the patient is treated, screened early, diagnosed early, then providing treatment. But this is only restricted to, from the central government point, restricted to only the persons who are in SEC category. That means around 50 crore population is covered through this. We do have other population, that means the CGHS beneficiaries, others who are covered. That means 40 crore population is there. We have to think about this population, how to cover this population with early screening as well as providing treatment for them. Having said this, I will just come back to the same things, how to do early screening and early diagnosis of this patient. So lot of programs are there. We are in the process of framing guidelines, see that how the guidelines evolve. In that, we can have a checklist. That means if the person is having some symptoms regarding this urological manifestation, because usually The prostate glands they exhibit the symptoms of inflammation as well as the hypertrophy as well as the malignancies. So these three kind of thing, if we can have a checklist kind of approach at the peripheral most level, aided by, because the sub health centers which have been upgraded as health and wellness centers, they would be aided with telemedicine. And if you look how the e-Sanjeevani platform of the ministry is now evolving and maturing, because if you do things on scale, that for a public health point of view, if you do things on scale, it usually takes time to evolve and get mature. As the things get mature and the capacities also increase at that level, you can add more and more things. But to begin with, for the as we are doing for the other cancer, we can have a checklist. If you can suggest that, okay, at least this kind of symptoms needs to be watched at the peripheral most level, and the doctor needs to be aware about that, so that in a prompt response. Because as Dr. Mandhani has already pointed out, that we do have hospitals as well as robotic facilities for robotic surgeries in tier 2 cities and tier 3 cities as well. That kind of linkage is there, so that the early symptoms identified and the person can be referred. And because half of the population is having this PMJ coverage, they can be referred to this the private institution or the institution having facility for at least a CT. Most of the district hospital, they do have facility for CT scan, and some of them would be having MRI, and some of the district hospitals which have been upgraded as medical college would be having PET scanning also. But since the scale is there and the whole focus was on primary care, so that's why we have to see that how we balance it. But to begin with, the screening can happen from by way of a checklist, so that the persons who is screening, the nurses and the health workers who are there at the peripheral most, at least they can identify the symptoms, they can segregate and refer the person to the medical officer at the community health center, or refer that patient to the hospital having this facility, urological facilities in tier 2 and tier 3 cities. That kind of things are evolving. And in the coming days, you will be seeing that other cancers are also being included as a part of the screening process. I will stop here.
Okay, thank you, Dr. Madan. As I was hearing you, couple of things that came to my mind, and I would like to love to hear Dr. Mandhani's views also. First is regarding awareness. Now in this digital era, we've got so many platforms available, and if you look at the Twitter followers of the Ministry of Health itself and Family Welfare, it goes in lakhs and millions. So on this platform, if we can share information regarding screening for prostate cancer in the form of small JPEGs, that would go a long way, because everybody reads Twitter, and I think Twitter follower in India is quite high. That's one of the way we can communicate. Other way is connecting to doctors who are catering to these remotest people and educating them of how to pick up early disease. Second is we can sort of weave a partnership with the private hospitals, maybe a direct connect, or maybe through a CSR activity where they can organize camps on a regular basis, or where the doctors are asked to visit particular villages and to conduct camps and to pick up these patients. Then that's the first step. Second step would be again directing them to areas where treatment can be meted out. Now, for example, in our part of the area in Mumbai, GIPSA doesn't cover the robotic surgery as such. But if this coverage are given in government sponsored schemes like GIPSA and any other schemes, it will go a long way, because robotic surgery has proven to be quite beneficial when you're treating early prostate cancer. So these are a couple of things which are randomly coming to my mind. And as I said, your support is extremely important for us to create that awareness and getting people to be diagnosed into early, because that's where we can provide the best treatment to them and improve their quality of life. At this point of time, I like to go to our end consumer, as you call it, was sort of a cancer survivor. तो राम भोला जी, आप हो यहाँ पर? राम भोला जी, आप हमारे साथ हो? तो so I first invite Dr. Preetham. अच्छा, राम भोला जी आप हैं?
हाँ, राम भोला जी बोल रहा है।
हाँ जी, नमस्कार जी। पहले तो बहुत शुक्रिया, आप टाइम निकाल के यहाँ पे आए, आपका जो अनुभव है शेयर करने के लिए। Mr. Rambola, just an introduction is that he is a cancer survivor. He was diagnosed with advanced prostate cancer. तो रामबोला जी, आप आपका अनुभव हमें बताएंगे कि जब आपको कैंसर कैसे डायग्नोज हुआ, आपको क्या लक्षण थे आपको, और डॉक्टर के पास आप कब गए, और आप आपका अनुभव हमको बताएंगे जरा।
अच्छा, आप समझ रहे कि हमको पेशाब में जब दिक्कत होना शुरू हो गया ना।
हाँ हाँ
हेलो।
हाँ, हम सुनाई दे रहा है, आप बोलिए।
हाँ, आप बोल रहे हैं कि जब हमको पेशाब में थोड़ा दिक्कत हो गया तो हम लोकल दरभंगा बिहार से डॉक्टर निकला। यहाँ पीएस के जांच जो हुआ ना था 18.6 आ गया, और यहाँ से डॉक्टर हमको रेफर कर दिया वही पीजीआई लखनऊ। पीजीआई लखनऊ जो पहुंचे 30 जुलाई 1915 को, वहाँ हमारे अनिल मंदानी जी ने ऑपरेशन किया। हेलो।
हाँ, सुनाई दे रहा है सर, सुनाई दे रहा है, बोलिए आप।
हाँ हाँ, तो वही पर वहाँ पर जांच हुआ, एमआरआई वगैरह करवा दिए, डेप्टी टेस्ट वगैरह हुआ। डेप्टी टेस्ट में 3+4 आया। तो मंदानी जी हमको माने कि एडमिट किए और वही टीका लगा करके हमको ऑपरेशन किए।
तो अभी आपको कैसे लग रहा है रामबोला शाह जी?
अभी हम बहुत ठीक है, अभी हमको कोई दिक्कत नहीं है।
रामबोला जी, रामबोला जी, मैं पूछना चाहता हूँ कि आपके जैसे बहुत सारे लोग होंगे जिनको दिक्कतें होंगी या जो टेस्ट नहीं कर पा रहे हो, तो आप उनको क्या मैसेज देना चाहते हो? क्योंकि बहुत लोगों को ये अंदाजा नहीं है कि ऐसे कुछ चीजें हो सकती है, ऐसे कैंसर हो सकता है जिसको हम अर्ली स्टेज में डायग्नोस अगर करेंगे, निदान करेंगे, तो उसका हम उचित उपचार कर सकते हैं। तो आप उन लोगों को क्या मैसेज देना चाहते हैं, क्या बताना चाहते हैं आप?
यही कहना चाहते हैं कि प्रोस्टेट कैंसर कोई बड़ा बीमारी नहीं है, ठीक नहीं। थोड़ा सा माने कि कंट्रोल रहेगा और समय पर डॉक्टर से चेकअप में रहेगा तो ऑपरेशन करने के बाद एकदम ठीक है। हमको तो ये 7 साल हो गया और आज के भगवान का एकदम ठीक है, कोई दिक्कत नहीं है।
ओके, धन्यवाद शाह जी। आप तो द मैसेज what is giving is that cancer is not bigger than you. It's important that you are aware of what problems you are having. Don't shy away. Don't attribute your symptoms to your age. It's not always your age which is causing the problem. Go and visit your local doctor. Let him have a look. Let him do the appropriate test, and whenever they need help, we are there to help you out. I also want to go to Dr. Preetam Singh, who has joined us. He's also a cancer survivor, and I would love to hear his experience as to the entire ordeal that he has gone through. Dr. Singh, over to you, sir. आपको mic on करना पड़ेगा, sir. Yes, you're audible, sir. Please go ahead. Please share your experience with us, sir. You have to unmute yourself, Dr. Preetam.
Yes, Dr. We got logged off because that cell phone died, its battery died. So I just logged in from my cell phone instead of laptop. You will have to repeat what you were saying, because we were not here in the session for a while.
No problem. So I want to hear from Dr. Preetam Singh, his experience of the entire journey that he has been through. So he can be an inspiration to many of them who are watching this at the moment. Dr. Preetam Singh.
Okay.
Please share your experience, sir.
Daddy, आपका जो experience हुआ वो बताओ.
I had a urination problem. My son took me to Fortis hospital, where I have been given a full treatment for prostate, Dr. Mandhani. Or now I am fairly well, and urination problem is not existing at all.
So you had.
So I'll add for him if you will not mind.
Yes.
See what happened in his case. The detection happened when this urination issue started.
Okay.
So because his urination first became intermittent and practically not happening, which of course led to urea in the body, and then loss of appetite, and then when you throw up, when you have that loss of appetite, and through some family friend, I found out about Dr. Mandhani, who is the right person for this kind of thing. Now, the other issue, what was there with him is my mom had heard somewhere, so she was very unkeen for biopsy. But his PSA blood count was already coming around 300, which was, so under Dr. Mandhani's guidance, what we did was we treated like a full cancer. And at his age of 86, we didn't want a surgical intervention. So there is an injection-based treatment, which of course the doctor can say more. And of course we did all those things like PET scan and, ultrasound, blood test, and all those kind of things before this injection-based treatment. So it's been happening for 4 or 5 months. Initially, his situation was that he could hardly eat, and he was sort of almost becoming bedridden. Now things have all sort of settled down. His urination is happening properly. We're going to have one more PSA antigen count test, which we will have soon because we have another injection due. But the PSA has come down to about 15 odd from 300. And he was not being able to walk. He was then on catheter for 3-4 months. So now we are not even using a catheter. And I think because other discussion which is happening, I just want to say from a end user's perspective, what you should also probably tell people, whoever is facing a little bit of a urination issue, urination is not coming properly, it is coming intermittently, then they probably have a prostate related issue. So then they should immediately anyway go for PSA antigen test and see a doctor. But you doctors will be able to comment better. I am a layman in this field. So this is what his thing was, And this injection-based treatment and good guidance from Dr. Mandhani, things have sort of settled down. But yes, we will do one more PSA antigen test, and then we will, of course, be seeing Dr. Mandhani before the end of this month once more to see what should be, if required, any next course of action.
So Mr. Singh, what the message is very clear from you to all the viewers is that when we act at the right moment and when we seek guidance from the right people, we are able to control the cancer well, and not only that, also improve the quality of life. So that's the message.
Absolutely.
I believe you want to give across to everyone. I think that's a very subtle message, and I thank you for that. But hold on to us. Now that the cancer has been diagnosed and confirmed, and you have heard from all our panelists, let's move on to the treatment part. And all the questions which are asked is, most of the people feel when it comes to cancer, it means chemotherapy, it means radiation, patient will be, morbid, patient will have to suffer a lot, quality of life is gone, and it's the end of life situation. That sort of thoughts come to your mind. I want to rope in Dr. Mandhani again. We talk about with the advances happening in treatment of prostate cancer, we talk about precision medicine, we talk about personalized medicine, and with so much happening virtually every day as far as research is concerned in treating prostate cancer. So, sir, what's your take on how we are able to, in this era, able to personalize treatment for a prostate cancer patient? Dr. Mandhani. Dr. Mandhani, is he there? Okay, so I think he'll be joining us back. So what I wanted to emphasize here is that there are many, initially we had about, 10 years ago, we had few handful of medicines which were quite debilitating and which did the job, but the patient had a lot of side effects. But now with so much research happening and this medicines being tried all over the world with wonderful results, they are also available in our part of the world, in India, in your nearby hospitals. And these medicines are particularly focused on controlling the disease if you are in latest or advanced stages of your cancer, in controlling the disease and improving your quality of life. We also discussed about treatment available when you're in early stage of cancer. So we have got robotic surgery, which is available. Now, the benefit of robotic surgery is that we are able to see better. Now, what I mean by that, and a very good example which I keep giving everyone is that if you look at anybody's hair, it's very thin. So these sort of nerves are there in the body surrounding the prostate. And when I'm able to see them through the robot camera, it looks like a pen. So you're able to see things that big. So when you're able to see things bigger, in a 3D version, 10 times magnified, so we are able to do better surgery. And that reflects on the outcome of doing this surgery and providing a good quality of care, and ensuring that the patient's quality of life is improved and bettered, and then that more than his expectations after doing a robotic surgery. Now that we have talked about this, and the PSA part has been already addressed, where people get worried about having high PSA. But what you need to understand is PSA is just an indicator of a prostate health. It can be just prostate infection causing the PSA to go up. It can be just increase in size of your prostate, which happens because of age. That can also give rise to high PSA. So with Dr. Mandhani coming back to us, sir, I'd like to have, I was just discussing about in this new era where so much technology has come in, so much research is being going on, we're able to give precision treatment, personalized treatment. So I want to know your views of how we can personalize treatment to a prostate cancer patient. Dr. Mandhani.
Question is regarding robotic surgery.
Sir, precise, stage-wise. You talk about advanced metastatic prostate. We have got so many medicines available. We've got robotic surgery platform. So what's your take on giving a personalized treatment?
You see, robotic surgery is the best for early localized prostate cancer. But if it is metastatic or advanced, then is not there. Then we have a lot of treatment options like hormonal therapy, chemotherapy, and various kind of other chemotherapeutic agents which can be used. So, I mean, the basic goal is to give the patient a good quality of life and lifespan, not the lifespan, but quality of. So, with the help of medical oncologists, radiation oncologists, and of course the radioisotope therapy. So we have almost more than 15 options to prolong the life and give the patient quality. So that is the beauty of current ways of managing this cancer.
True. So, Dr. Mandhani, one of the other aspects which we face in our daily consultation is that most of the patient inquire is that their father or their mother or their uncle had cancer. So, what are their chances of having cancer? Or if they themselves are patients who have been diagnosed with prostate cancer, what are the chances of their sons having cancer? So, in this present scenario, Dr. Mandhani, what sort of options are available where we can tell the patient of their chances of having cancer if their father or their uncle has cancer?
Yeah, see, for that matter, any cancer has two ways to come to their progeny. One is genetic, like you're passing genes to your progeny with cancer. And second is you're living in an environment, we call it familial cancers. You're living in the same environment and there are artificial changes to your genes in the developing cancer. So I think prostate cancer, both the group form around 5 to 10%. So if like I have cancer, then maybe my son has, I wouldn't say how much risk, but yes, maybe like you take 100 fathers with prostate cancer, maybe out of those 100, 5 to 10 children of them will have cancer. Now, who will have cancer and who will not? It's very difficult to identify. So in that way, like for breast cancer, we are testing a BRCA gene, like Angelina Jolie had prophylactic mastectomy. So the research is going on in that direction. So can we predict that the person will have prostate cancer or not? But the question is, even if we predict, is it possible to do prophylactic removal of prostate? Because as I said, surgery comes with two important side effects. So that question is far away from reality. So maybe in future we will have answer to that.
True, Dr. Mandhani. So what message you want to give is that there are technology and tests available where we can predict your chances of having cancer if your father or uncle, or even if your mother or your sister has got breast cancer. So what's your chance of having cancer? We can predict it. But the flip side is that even if we find a mutation in your gene, that doesn't really mean that you will develop that cancer. It's just that you need to be vigilant of doing your screening at a probably an early age, and help us to pick up things early. So moving again to Dr. Madan is, sir, we would like to know, are there any specific initiatives or projects that have been that are in the pipeline as far as Ministry of Health and Family Welfare is concerned, which are focused on creating awareness about early diagnosis of cancer, let alone be prostate, any cancer, and awareness about the treatment available in India for that particular cancer, Dr. Madan? So you need to unmute yourself, sir.
Sorry. Dr. Santosh, as I mentioned, we do have a national cancer control program. And one of the important thing is early diagnosis and putting the person on treatment about this, whatever cancers are being detected. But a lot of work is to be done, because right now it is focused on this pap smears for your cervical cancer, the breast cancer, examination of the breast for the identification, early diagnosis of breast cancer, the lung cancer, and the tobacco-induced cancers. The whole focus is revolving around that, because they have become a public health problem.
True.
But regarding the prostate cancers, you look at the evidence which is there about the causative factor, not about the genes and other things. What are the causative factors for the person getting predisposed to having this cancer? If you know that kind of precipitating factors, we can institute some preventive strategies for that. But nevertheless, some evidence is available saying that lifestyle modification, that means reduce smoking, alcohol, as well as having a healthy lifestyle, so that will reduce the chance of person getting this. But still, evidence is awaited. But nevertheless, this can be tried, because no harm in trying that thing. With wellness, because now we are moving from the disease we have moved to health, from health we are moving to wellness. In the wellness part, in the peripheral most areas as well as in the corporate hospitals, now you are having wellness clinics. Now you see that there is a paradigm shift in the way we are thinking, the society is thinking, the government is thinking. We have moved from disease to health, from health to wellness. That kind of journey is there, and things are evolving. When we are moving from in the wellness thing, if we are able to impart a behavioral change in that person. You have mentioned that your Twitters are good for providing information. But how to nudge that person to have a behavioral change? We say that you be aware, don't be shy of going to the doctor. But who will nudge that person to go to a doctor? That's a challenge. And we do have community level workers in the form of ASHA who can at least nudge the people, saying that if they are having symptoms, go to the doctor and get themselves treated. That's the first step which is there. Second thing is regarding making the people aware, and with this workers network of around 1 million workers is there. In the urban areas also similar kind of network is being created. If these people nudge, definitely there would be a behavior change, and the people would be coming as early as possible for getting themselves treated and screened. That's one thing. Second thing is the capacities with the system. If you look at the way, how many urologists we are having in the country, that is a question we have to identify. The medical colleges produces a set of urologists, and the DNB courses are there, but there is lot of scope for increasing the capacities for DNB training of urology, so that if the persons who are diagnosed, at least they can be given proper treatment. We have been talking about the telemedicines as a part of at least helping with the capacity available at the center to the people working at the periphery. But there also you require urologists to guide that person. How many people are there? All the urologists, they are busy with the workload and other things. So now we have to see that how we develop a capacity development module, which we have done effectively through online medium during the COVID times, when there was we do have a center of excellence at AIMS, and they usually design some course curriculums based on the requirements, and immediately the training is imparted to the doctor, so that the knowledge which is there, without transmission loss, it reaches to the peripheral most, and with certain kind of hand holding, now you are seeing the results. In the COVID, we have done that effectively. For the prostate also, we can do that effectively. In summary, we have to say that the awareness, for building awareness, people and the network is there. You have to only see that how we nudge them so that a behavioral change can happen. The survivors can act as champions. They can at least nudge the people, guide the people so that early diagnosis can happen. The second is the association and the, as a urologist, as a policymaker, we have to see how to build capacities. That's a bigger challenge, because if you look at the urologists, how many urologists? Around 2,000, 3,000 urologists. Are they adequate for a population of 1.4 billion? Even if it is the number 2 or number 5 in the men's cancer problem, you have to see that how they build capacities. Training a urologist, it's time consuming thing, but shifting some of the capacities, multitasking the MO at the peripheral level, so that he can at least be guided. Because in the other cancer programs, you look at the way the hub and spokes things work. The cancer specialists, they usually guide the district level person. That kind of already network is there. Can we think of similar kind of program? Can we think of increasing the capacities in the form of trained urologists across the country through all the private beds which are available in the urological sector? Can we use that beds for training of this urologists through DNB programs? We have been able, negotiating with the National Board of Examination, asking them, as a result of our efforts, now you see the criteria for having the consultants, the faculty, that has been reduced. The criteria for the beds is reduced. Now they are working on criteria for a single specialty hospitals also. Now they are roping in. We are making efforts to increase the capacities of the specialists as well as this, but the cutting edge would be the peripheral most doctors, where we require capacities, and we can use the online media for building capacities there. And for nudging, so the efforts are being already going on. Now see that how this nudge evolves, and you will be seeing more about more and more people coming to the system or getting them to the screen. That kind of awareness is being created, but it takes time, and we are moving in the positive direction. I'll stop
True,
here.
Dr. Matan, yes. So two things I would be taking from what I heard from you is that one is the people who are listening to us, if they're able to pick up the message and they're able to, what you say, cone down to any senior member in their family who's having symptoms like this, so they can encourage them to go and visit their doctors. It can be anyone. It can be a general practitioner. It can be a general surgeon. He can be a urologist, depending on what the availability they have. So that even if they do that after listening to this session, I think our motive is achieved. Talking about availability, and I think most important is empowering. I think empowering the community health worker with key messages and key information as to how to interview and interact with with public, and try to pick up people who may be having symptoms. We are not talking about diagnosing cancer here. We are talking about elderly people who are having urine problems for a long amount of time, but just because they are not aware of it, for some reason for the other, they are not seeking medical help. Even if that is being done, I'm not saying we are here to diagnose cancer in everybody, but if the elderly people, if the awareness is made to them, if they are made aware by this community health workers as these symptoms could be an early side of cancer, and they can be directed towards a person who can give appropriate care, I think our motive is achieved. Going back to राम बोला जी, मैं आपसे वापस निवेदन करता हूं कि आपको जब ये कैंसर डायग्नोस हुआ, राम बोला जी, आप सुन रहे हो? हाँ जी, आपको सर ये जब कैंसर डायग्नोस हुआ तो आपका फैमिली का सपोर्ट कितना महत्व था, कितना महत्वपूर्ण था सर?
हम तो एक टेंशन हुआ था ना।
हाँ,
सबसे हमारे बगल में है डॉक्टर सिंह का।
हाँ,
कराया, उसके बाद निकला था बॉम्बे में है, लखनऊ की है।
ओके,
इसका तो इलाज सब जगह में है।
तो आपका फैमिली का सपोर्ट कैसा था सर? आपके फैमिली ने कैसे सपोर्ट किया आपको? आपके दोस्तों ने कैसे सपोर्ट किया? वो भी बहुत जरूरी होता है।
कि हमारी पत्नी है एक लड़का,
हाँ हाँ,
लेकिन वो लड़का और पत्नी को हमने साफ सुथरा कहा कि ये बात है, डायग्नोसिस में से निकला है और डॉक्टर आपको रेफर कर रहा है बॉम्बे या लखनऊ की है।
ठीक
तो
है,
आप नहीं जा दिखा लीजिए और पत्नी के साथ
ठीक है, ठीक है, ठीक है।
पूरा सपोर्ट मिला, मुझे कोई नहीं
तो ओके, तो राम 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 बोला जी, आखिर में पूछना चाहता हूँ कि आपका ये जो सफर रहा है कैंसर के साथ, आपका जब जैसे डायग्नोसिस हुआ है, आपका ट्रीटमेंट लेने तक, तो उससे आपको सीख क्या मिली है जो आपको दर्शकों के साथ आप बांटना चाहते हो? कुछ सीख मिली है आपको जो आप बोलना चाहते हो? कुछ चीजें दर्शकों को बताना चाहते हो?
हाँ, हम तो यही और बताना चाहेंगे, हम सिर्फ इसमें घबराने की बात नहीं, सचेता की बात। मन में लोग रहेंगे सोचे कि हमको कैंसर हो गया, और ज्यादा अगर सोचेंगे माथा में रखेंगे तो गड़बड़ है। इसलिए कोई परेशानी नहीं करना है, नॉर्मल वे में इसका इलाज करना है, और तो बहुत बढ़िया इलाज हो गया है। और सबसे बड़ी बात दिक्कत ये है कि हर जगह इसका इलाज नहीं। अब जैसे कि हम बिहार का बंदा रहने वाले हैं, हमको अगर दरभंगा में या पटना में कहीं इलाज होता था, हम उतना दूर नहीं जाते, और थोड़ा पैसा भी ज्यादा खर्च होता है।
ठीक है, ठीक है, ठीक है,
होना चाहिए,
ठीक है, ठीक है, ठीक है। धन्यवाद राम भोला जी, आपने जो आपका अनुभव हमारे साथ बांटा। तो द मैसेज वाज what he wants to give is that don't be scared once you're diagnosed with cancer. It's important that you seek the right people, because treatment is available now even in the remotest area. And he hails from Bihar, and he right now he's been he came to PGI Lucknow to get treated. And that's, you can see how awareness and seeking the right treatment can help you lead a normal life. I would like to ask Dr. Preetham. He's been waiting patiently for a long time. Now that we are coming towards the end of the session, very fruitful session, is that what sort of things you feel in your journey you felt that were missing and that should be there, so that people who goes through the same treatment or same experience should not have that sort of gaps in your journey which you feel that should be there to make the gap even more smoother for the future patients? Any sort of input from your side, sir?
पूछ रहे हैं कि भाई जो आपकी जो जर्नी रही ना, उसमें डू यू थिंक मतलब कुछ और अच्छा हो सकता था, इम्प्रूवमेंट आपको सपोर्ट करने में? I think his case is he's quite satisfied with the way things went.
काफी ठीक हो गया है.
So basically, only thing is, yes, as you rightly said, if people like me who are his family, friends, younger people with the elderly, if they know when you have a urination problem, it could be basically, and I think when you do this promotion, don't say to end users cancer, say prostate enlargement, because in India still, cancer word, people sometimes get a little scared. I'm talking about non-medical fraternity people. As far as he's concerned, I don't think he feels there's been gaps, because one is
to work with drug industry.
so that's all right, Daddy. So basically, in his case, there was no really gaps, except I don't think we had any gaps. We had a good support system. His wife would, make, when he was not being able to eat, make those liquidish sira, all those kind of things. So she was taking good care of him. Dr. Mandhani was taking good care of him. I was being the driver, so it was manageable. So
Brilliant.
no gaps which we felt. Okay.
Brilliant. So I think what I get is that a holistic approach is necessary when you're treating and managing cancers, prostate cancers. Not only getting diagnosed and being treated by medicines and surgery, but also your support from your family is
support
equally
system
important.
helps.
And that's important. And our government has been so proactive with so many schemes I'm sure they are working hard towards getting things feasible. They've already done so much. I'm sure they'll be pushing more hard to get things done. So I think this message is very clear from this session, is that prostate cancer, or matter any cancer, if diagnosed early, can be utilized to give you adequate treatment, make your quality of life better. But for diagnosing early, it is not just the doctor who is important, because we'll be suggesting you the test and we'll be giving you the right direction depending on the test results. But what is important is the awareness you would be having after this session, and you can spread. Even if one person who's listening to us today can talk to 5 different people, and those 5 people can each talk to 5 different people, I think that's a chain reaction which we want to initiate today. And it just remember, it is just one blood test. It's a 5 ml blood, which will go a long way in helping us to pick up cancers early and treat you at the right time. It's just an executive health checkup, which you need to do in the week next to your birthday. That's all you need to do. And then come and visit your doctors to get treated well. I think I end this session. I want to thank especially Dr. Preetham Singh, Mr. Ram Bola Shah, who took their time out and to share their experience. I think that's the most important part of the session. Apart from we doctors discussing about the nitty-gritties, I think your experience would go a long way to encourage the viewers to come out from their shell and approach and seek the right help. I want to thank Dr. Mandhani to take this time out and discuss about the treatment and the diagnosis part. Dr. K. Madan Gopal, who has been so good and encouraging us and giving us the positive side of all the government policies and the initiatives that the government are willing to take. That's so very encouraging. Last but not the least, I want to thank Voice of Healthcare and AstraZeneca for getting this initiative done in this important International Men's Health Week. I bid adieu to everyone, all the panelists. Thank you so much. Have a wonderful weekend. Stay safe, stay healthy, take care, and be vigilant. Thank you so much. Thank you.